Welcome to another episode of the Interesting MD podcast. This week I have Dr. Marcia Glass. Marcia, thank you so much. Welcome. Maybe we can talk about how you would get involved with like humanitarian aid, MSF, things along those lines. So how do people get started and what kind of qualifications would they need?
So I told the recruiter that, and I remember they were telling me, what's your experience and blah, blah. I mean, have you ever been out of the country? Can you deal with lack of electricity and water? And I said, we just went through Katrina. I'm from New Orleans. So they're basically like, you're hired.
Stamp. Welcome to the Interesting MD podcast, the show about what doctors do when we aren't seeing patients and how this can help us find balance and prevent burnout. I'm your host, Rob Beck. Welcome to another episode of the Interesting MD podcast. This week I have Dr. Marcia Glass, who is going to be talking to us about working overseas and traveling overseas. And she is a genuinely just very fun, cool person. She was a mentor of mine at Tulane when I was a resident. And now she lives in San Francisco. She's going to tell us all about it. But I am incredibly honored that she returned my text and has agreed to come on this podcast. So, Marcia, thank you so much. Welcome.
It's an honor to be your friend.
Yes, well, likewise. So where are you from? Tell us a little bit about yourself. Where are you from? What do you do? All that good stuff.
I grew up in London and Puerto Rico. My dad was a reporter for the Associated Press. And I learned recently that I'm a third country kid. I might be a third party kid.
I was trying to figure out how that worked.
Neither that nor that. Third country where I grew up in more than two countries, neither of which was the place of my parents' birthplace.
Okay.
Although, of course, Puerto Rico's a commonwealth. But I guess, anyway, just to say, I've always been a bit of an outsider, which is fine right now in the U.S. because that's how all my friends feel too. Right.
Fair enough. All right. So when you bounced around, where'd you go to med school? Where'd you go to undergrad? Where'd you go to med school?
Yeah. I went to undergrad at the University of Chicago, which at the time had a much higher acceptance rate than it does now because I don't think I could get in now. I'm pretty sure my kids can't. But then I went to Georgetown for med school. My parents lived in DC, so I went back there. And I applied to Tulane on a total lark with zero intention of going to New Orleans. But my grandfather, I don't know if you know this, but he was a doctor at Charity Hospital. So,
I did not know this.
Yeah. So I just applied because my dad kept pestering me. And then I went down and it was like January and it's 70 degrees. Sorry for all you Canadians, but...
Right. It was like 20, 21, 19, 20.
Oh, God. No.
I now speak, I'm bilingual now, so I can sometimes do room temperature.
Oh, no, that's just around. So, and I sat on Freshman Street and drank a daiquiri at like 2 p.m. And I was like, maybe I want to move here. And that's how I ended up in New Orleans.
Okay. And how long were you there once you went there? Because your initial experience in New Orleans was way better than mine. I went down getting into the School of Public Health, but I went down, I think I drove down in early June to visit. Maybe it was, I think it was early June. I kind of had to drive down after work and it was really, really hot, but not as hot as when I moved there in August. And that was, I was like, oh, I'm from the South, but this is like really, really hot. And I don't want to move anything out of my U-Haul trailer.
Wait, where were you from?
So I grew up in Tennessee, but when I moved to New Orleans, I was living in Cincinnati. And that was a little bit of a shock, honestly, moving to New Orleans, where, it was like a totally different, I had traveled to a different country.
Yeah, that's why I like it, especially right now. But I never really left, literally or figuratively. I mean, I still feel like, especially today, because this is being recorded on Mardi Gras, I still feel like I'm there. We still have a house there. My sister lives there now. And I've bounced back and forth between San Francisco and New Orleans for the past decade. So the story I told you was in 2003. And for the next 20 years, I've pretty much always ended up back in New Orleans.
It is very hard to leave New Orleans. I went down there for 18 months and I was like, okay, 10 years of marriage, 3 kids later.
Yeah.
All right, now I've got to go.
Yeah.
I've got to go now. And I kept my Saints season tickets for 7 years after we left. It was just like, I can't quite leave. So I just have to hold on to my tickets. I can't leave. But anyway.
Do you have a 504? I don't remember.
I did. I kept my 504 until we moved to Canada, and then that just became impractical.
Yeah.
So now I have a 778. It's not nearly as, I don't know. It's the same thing. It's 3 numbers, but it's still just not as exotic, I guess. So
yeah, that was the whole thing after Katrina, because I went through Katrina in residency and had to evacuate and all that nonsense, which is the first time I ended up in San Francisco, by the way. Yeah, because they said they were sending everyone to Texas, and I was like, no, I don't want to go to Texas. And so I had a connection at UCSF, and they sent me there. So I ended up at UCSF in the middle of my 3rd year of residency, and all my co-residents, everyone around me, ended up all over the country, but we all kept the 504 area code. So this is my same number from back then.
That works out very well for me, actually. So now I could text you 15 years later and be like, hey, I'm not sure you remember me, but I'm starting a podcast and thought that you'd be really cool. I stalk you on Facebook sometimes and or Instagram. So that works really well, except for the fact that I've changed my number. And now you're like, some dude with a 778 number is texting me claiming to be some dude that I remember from like barely a long time ago. So during what's that?
You never know who's going to show up like that.
Yeah. I know. So your 3rd year, so this is kind of gets to a little bit of international work, is that you had this experience of going through, you were in 3rd year residency during Katrina. I was 3rd year med school. And so our Katrina experience, we left, we we evacuated. Andrea was pregnant during that time. Yeah. So kind of the mark of that was we had finished our first block of 3rd year. And I'd finished my internal medicine rotation. So I was actually one of the last people to work in old charity. So as a med student, before it got flooded and all the horrors there. Yeah. But we ended up, evacuating and going out. How long were you in San Francisco?
I was there from August, sort of September. Because for a while I was just totally
a nomad.
A nomad. I remember going to an ATM and checking to see if a paycheck came in, because our entire Tulane server crashed, as you remember. So we had 0 communication. I happened to be away for a wedding. That's why I wasn't in the storm. But I had no contact except some of my friends to be able to get messages out, but it was pre-text message too. And I remember going to an ATM and looking to see if there was money that came in that day. And that's how I found out that I was still getting paid. And so my friend said, I just got you a ticket to Burning Man. I mean, you may as well do that. So
You're like, you know what? I'm game. Yeah.
In the middle of Katrina. And after that, I pretty much just stayed. I mean, I sound like such a hippie with this story, but I stayed until January of 2006.
Yeah,
2006. And then it was a real branching point because people had started to go back to New Orleans, and my co-residents had come back because they wanted to get the hell out of Texas. And I wanted to stay in San Francisco, but I felt drawn to my co-residents and kind of loyalty-wise. And so I went back for those last 6 months. But I felt like I had mixed feelings about that decision, because I felt like career-wise, I was maybe going to be on one path if I stayed in San Francisco. Yeah. And potentially I had sunk all that to roll back into New Orleans, which was in total disarray, as you know. I mean,
Total.
total
Total. To the people
disarray.
who don't remember, we're coming up on the 20th
Yeah.
anniversary of Katrina now.
Yeah.
I mean, there was one red light.
Oh, yeah.
The entire area of town where we lived in mid-city, kind of Gentilly area. We lived right by the fairgrounds, and the power didn't come back on there for 8 months. I mean, that whole area, there were boats in the street. There was, I mean, it was insanity. There's nothing that I have ever been able to see that compares to that, at least in the United States or Canada.
So that was basically my job interview for Doctors Without Borders, because while I was out at UCSF, there was a recruitment lecture, and I'm sure they go to all the really liberal schools, but they were recruiting for Doctors Without Borders. And I went and talked to the speaker at the end, and I said, I'm graduating in June and I want to do this. I mean, I know I want to do it because I remembered them winning the Nobel Peace Prize when I was in high school. And my dad, who was a reporter, showing me the Washington Post and saying, maybe you should work with these guys sometime. So I knew I wanted to do it. And then all that craziness with electricity and everything, I kind of solidified it. So I told the recruiter that, and she connected me for some sort of like informational meeting. And I remember they were telling me, you know, you need to, what's your experience and blah, blah. I mean, have you ever been out of the country? And can you deal with lack of electricity and water? And I said, we just went through Katrina. I'm from New Orleans. So they're basically like, you're hired.
Stamp. Oh, we've never been in that situation. So
yeah.
Yeah. I mean, those days it was a war zone afterwards when we were, I mean, just shootings all over the place, like gunfire at 2 p.m. Like that was an intense time. We kind of had a similar story that we evacuated. The morning that we evacuated, it was the Saturday morning. The governor, you know, we wake up from the party the night before and the governor's crying on TV. And I think, well, if the governor's crying, I'm not sure that we're exactly prepared for this. So we need to get the hell out. Like, we need to leave.
Oh, yeah.
So everything going to Houston was 24 hours. Like it was completely just a disaster going to Houston. Everything going north towards Memphis and towards Chattanooga, where I'm from, that was taking people like 16 to 18 hours. And so I had the genius idea. I was like, we're just going to get east of the storm. And so we drove to Panama City, and there was absolutely no traffic whatsoever. Like we just got out and we were driving 75, 80 miles an hour, no problem. Once we got out of the city, it was perfect. And so we were just, you know, thought that it was going to be kind of the usual. So we took 3 days of beach clothes and our dog. And Andrea's pregnant at the time. We took a couple of classmates that went with us, rode it out there, and then realized that, oh, this was actually a lot worse than what we thought. So we ended up going to my parents' house for about a week. And then we went to Andrea's parents' house because they had like a basement apartment and whatever. So we drove to Toronto, kind of hung out there for about 3 weeks, 4 weeks, maybe 3 or 4 weeks. And we had been on the phone because, I mean, again, there was no ability to communicate with anybody. So when your entire city gets destroyed and your home area code gets destroyed, you actually can't make calls out because, you know, we didn't find this out until later, but when you are out of your area code and you make that call, it goes back to your area code and then out. And so we could not make phone calls out. But eventually we had gotten accepted, like the dean of the medicine or the dean of the med school at Johns Hopkins accepted us. He was like, yeah, you two come on. It's no problem. We were like, oh my God, we just backdoored it into Hopkins. This is amazing.
That's how I felt. Yeah.
Yeah. I was like, oh yes. Not that Tulane is not a great school, but we just had a little bit of an inferiority complex. And we were like, oh my gosh, this is amazing. And so we were packing up and we were going to leave the next morning. And the dean called us and was like, nope, head to Texas. You've got to go to Houston. And
which dean? The Hopkins
dean? Yeah, the Hopkins dean. He was like, yeah, I've been told that I can't accept you guys. Like you have to go to Houston and meet everybody there. And you need to get there. Like they told us that you have to get there now. And I mean, we're in Toronto. And so we have to drive with our dog and Andrea being quite pregnant all the way. And we made it to Memphis. And then there was a huge blackout in Memphis that night. And then we went, and as we were driving through Dallas, Rita was coming up and hitting Houston.
Yeah.
And so then we started getting all these phone calls like, stop, 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 where you are. And so we just pulled off the road and got a Red Roof Inn. And we had to stay there for a week while Rita came through, did all of its damage. And then we were in Houston for 8 months before we could find, because we had our son in January. And so.
Was he born in Houston?
Yeah. He was born at Texas Children's. Wow. Thankfully, he spent a week in the NICU. So it was, I'm glad we didn't have to do that in Post-Katrina New Orleans NICU. So we were very thankful to Houston for that. But yeah, we moved back in August or in April. We could finally find a place, and we moved back in April, and there was nothing there. All of my ER rotations were at Lord and Taylor. Yeah. But before it had that was when it was like the bottom floor of the Lord and Taylor department building across from the Superdome, for the people that don't know, for my mom who's watching and probably nobody else. But yeah, thanks, Mom. I do appreciate it every week. That we had to, not we, but they had taken over the entire basement or main floor of the Lord and Taylor department store, and had just put up beds and shower curtains as the ER triage. And, somebody wrecked their motorcycle, and they brought him in on the back of a truck, like a sheet of plywood that was in the back of the truck. And they just dumped him in, brought him in, threw him in, and that was it. There was nothing.
There was a sign at the convention center that said ER residency interviews this way, like a handwritten sign. And I was like, oh, this is such an interesting weeding out process.
This is a selection process.
ER doc, right, who sees that sign. This is the most ridiculous thing. It's like, I want to train here.
Yeah, it definitely takes a certain personality to be like, yeah, sure, why not? It's like spray painted on the wall of the convention center and the big X, and ER residency this way. And then the ones that didn't go this way got to come, and we're like, yeah, that's cool. All right. Well, so is that when? So how did you start working overseas? This is kind of what we're working on and talking about now, is about the adventurous spirit of somebody who just wants to try something a little bit different and kind of test your skills, see something new. So when did you start working overseas?
I did a couple of rotations in med school. I went to Argentina on a rotation in early 2003, and then I went to India on somewhat of a rotation in mid 2003. And
like a fourth year rotation.
Whole nother story. Yeah, this overlaps more with the Burning Man side of things. And then I volunteered on a medical shift in Haiti while I was a Tulane resident, and honestly, I'm not sure how I even got that approved. They had no idea what I was doing, and I just went to Haiti.
Where were you? Were you in Port-au-Prince or?
Yeah.
Okay.
And my friend, who I also signed up for it, not only did she end up working on this medical mission project, she ended up helping sail the boat down to Texas. There was a ship, like a medical mission ship, and she ended up at the helm of it watching for whales. So I did not ride the ship to Haiti, but I did work in Haiti. And all of that was like its own thing. I mean, I'm not religious, and that project was, and I immediately was like, oh, okay, that's not my scene. Like the whole having clinic and then kind of trying to convert people so that they get their antibiotics. I was like, no, I'm not feeling that. So I started doing the humanitarian aid side of things in 2006, as soon as I got done with residency. And I did that off and on for the next 6 years. Like when I knew you, I was working half-time as a Tulane hospitalist, and half-time I was out of the U.S. So I did MSF twice, I went back and worked for the Liberian government for a while, which was very challenging and crazy. But MSF had left Liberia, and all of my former coworkers were still there. So I wanted to go be a doctor and still help, but there was no Doctors Without Borders anymore, MSF, Médecins Sans Frontières. So I just tried to get a job in the local hospital, but that's hard to do when you're just basically walking in the door. And then the guy that I was...
So what I'm taking from this is you don't recommend just going to another country commercial and then just showing up at a hospital and be like, I'd like privileges, please.
Yeah.
No matter where it is.
Generally, yes. And I had a reason to go there. Like I knew people there and I knew that this was the hospital that we'd handed off to. So it seemed like a reasonable plan. But the guy that was the CMO, the chief medical officer, had been the personal physician for Charles Taylor, the dictator. And that's who I was applying for a job from. So it was a very weird experience. And they basically let me work there as a quote unquote intern. So I was an attending in the US. But you know, the same thing you hear about people immigrating to the US and they have to repeat it, or Canada and they have to repeat everything. They made me do that in Liberia. But the problem was there were no other doctors. So they would call me the intern, but there was no one to supervise me because there was like 4 physicians in the entire country. So it turned out like I was the intern, but I was also responsible for like the whole ER. And the only thing that made me an intern was that they would schedule me for 72 hours straight. So it was brutal. I mean, I definitely couldn't do it physically now. Like every time,
it's a young person's game.
Yeah, if you tried to take a nap, like you can't work for 72 hours straight, right? So if I tried to take a nap, I would just have to make the peace with the fact that some people were going to die because I was napping, because the mortality rate at the hospital was 30%. So if I went and just from sheer exhaustion, I went to lie down, if the nurses didn't come get me, which they often wouldn't, like no one's getting coded. Like nobody's, I mean, stuff was pretty dire there. Like they just emerged from the Civil War. So it was really like people dying of tetanus and 17-year-olds with meningitis and little babies being born in a taxi and then arresting, you know, it's like what you hear about the crazy global health stuff, like that period of my life.
It was that.
And I guess all my like war stories and such are from that time. But I started wanting to do something that was a little bit more sustainable, you know?
Yeah.
Like, wow. Yeah. And that's how I got more into like ongoing programs with a site where I got to know the people and, you know, more education focused rather than I'm going to come in and be the only doctor for thousands or hundreds of miles around and just try to do a bunch of crazy stuff to save as many people as I can. I became more interested in like how to build capacity on the ground.
Yeah. Training people up and putting a system in place as opposed to just trying to come in and be the savior for them all.
Yeah. And I feel like at that time, the Doctors Without Borders was very much in the sort of colonial, like where the doctor's coming to save everyone mentality. I mean, I know they've done a lot of reckoning now and they've started talking about these issues and stuff, but they weren't talking about that at all when I did it. And it just really struck me like we're supposed to be the good guys, but yet there's a lot of stuff that I find really problematic. For example, we had an end of year party and all of our staff were invited, most of whom were Liberian. And then there are a few expat doctors and they signed us up to bartend and that kind of thing. But the rule was you could give anybody with a bracelet could have unlimited drinks and anybody without a bracelet could have 2. But the problem was all the expats got a bracelet and none of the locals did. So the rule was basically that if you were white, you could have unlimited drinks. And if you were black, you couldn't. And just things like that I didn't really expect to find, but definitely turned me off of that side of things a bit.
Well, I mean, I think that that's one of the more important things about going overseas is
Yeah.
realizing just how different everything is. I mean, even I just crossed the 49th parallel into Canada, and things are definitely different. Not just the healthcare system, but things are different. The people's views are different. There are a lot of indigenous patients here, and they have their own health authority and things like that, but they have been severely, severely underrepresented and undertreated for a very long time. And Canada's trying to make up for that. It's a
Yeah.
little, too little too late, but
Yeah.
they're making an effort. They're trying. But going overseas, Andrea was in Haiti for 3 months in 2003, in the summer of 2003, doing a maternal fetal transmission for HIV food program, so that they were trying to distribute food and humanitarian aid and antiretrovirals to prevent maternal to child transmission during birth. And so they were trying to give nutritional support, antiretrovirals during the peripartum area or
Mhm.
time.
Yeah.
And it was very, very different. And I spent 3 months in Ghana in the summer of 98. And it was really, really eye opening to me. I mean, I was 19, 20 years old
Yeah.
and started to really, for the first time, and being from Tennessee, you see some things about difference in race and whatever else.
Yeah.
You hear all this stuff, but it was very different. And it was
Mhm.
very, very uncomfortable the way that I was treated and just the way that I was thought about and looked at. But it was kind of one of the more eye-opening and growth times of my life as
Mhm.
well. I mean, it was really, really important. I was there kind of doing medical missions, but I kind of quit doing that part of it. But I got to go to like villages where there was still guinea worm, and it was, malaria. I got to work in the clinics and see malaria and schistosomiasis, and I even got malaria. All kinds of, yeah, that
You
was great.
have
I lost,
questions?
yeah, yeah.
What were you on?
So, mefloquine, Lariam.
Really? Did you
Yeah.
skip a dose?
No, no, I took everything but
Whoa.
like 100%. But what happened? I mean, I have the metabolism that mosquitoes really like, and so when I was there on day 6, I started getting fevers and chills, and I had all week long been seeing people like with malaria, and they were like, "Yep, it's malaria. Yep, it's malaria. Yep, it's malaria." And I mean, I had hundreds of mosquito bites despite wearing all the DEET. I didn't have a net that I was sleeping under at night, so probably would change that if I were to go back. But I mean, I lost 25 pounds in
Jeez.
2 weeks. It was awful. Like I really thought that I was going to die, and was kind of okay with it after a
It's
while.
intense. I mean,
Yeah.
when expats get malaria, it's like we had one visiting doctor who got it, and all of the like Liberians in our hospital were coming to the dorm. They just like wanted to see her to see that she was still alive, because they were like, it's no joke when white people get malaria, because
Yeah.
we had no resistance, right? So
There was like
we
no
just
immunity to it, no resistance. My body was like, come on in,
it's
guys.
terrible.
Just completely. Oh, it was so bad. I ended up getting it 4 times over the 3 months.
Oh,
And the next three were not as bad, but that
wow.
was like how I remember my 20th birthday was I had malaria. So it was awesome. So we've been talking about so many great and wonderful things about working overseas.
Yeah.
Come over here, come over. But from all of this, what do you take from it? I mean, how has that changed the way that you practice here? How does that help kind of balance your life? And
Yeah.
what have you done with that?
What's the last thing you said?
Yeah, no, I mean, like now, obviously, you still go and do work
Oh
overseas, but
yeah.
how has that changed? And
Yeah.
uh,
Yeah, the for the last question, I have to do shorter projects now. My husband is actually second career medicine, and so he's a resident. Haha. And we have 3 kids under 10, so I can't really like go disappear myself to Timbuktu for 6 months, even when
yeah,
I'd like to. But I'm on shorter projects, and I help run a program to train people in palliative care in resource limited settings. And that's a shared program between Harvard, UCSF, and Tulane. And we send fellows to either India, Uganda, Trinidad, or Chile or Navajo Nation, and that was Navajo Nation, I think, cut. And they get to practice palliative care in a totally different setting, but it's really with a reciprocal focus. So they have a lecture series, and about half the lectures are given by people in those sites. So the India site, for example, gives a lecture on how they increase morphine access in India and how they changed the laws there to even make it legal to administer morphine. And in Trinidad, they give a lecture about starting palliative care in the Caribbean. So it's very different than like the humanitarian aid model. And our fellows have written papers up with people from those sites, and it's very collaborative. So I find that really rewarding. And while working with that group, I met the dean of the public health school in Kinshasa, who actually has a connection to Tulane because Tulane founded the School of Public Health in the DRC.
Wow.
It's really odd. We're like super famous there. It's like the Harvard of the US. For
Clearly, yes, clearly.
Republic of Congo. So
my student loans think that we are.
I know, for real. And he gave a lecture at Tulane, and then I told him about the program I worked with, and he's like, "Oh, do you want to send some fellows here?" And I said, "Sure, but I'd really like to see what you're up to." So that's how I ended up visiting a year ago, and I've just been really impressed with what they're trying to do. Like, they're building a palliative care program for the DRC, and they want to start a fellowship. And I told them I'd help because I started the Palliative Fellowship at Tulane, which was the first in the state of Louisiana. So I figured if I can do it in Louisiana, I may as well do it in the Congo. But the twist is it's in French. So I have been bringing some trainees with me who speak better French than me, and my 9-year-old kid who also reminds me that he speaks better French than me. And it's kind of fun to have the challenge, in my late 40s of pushing myself. I mean, the language is challenging, but it's also, Francophone French. So it's a little more accessible than if I was trying to do it in Paris.
Right.
I mean, non-France, East African French is, for all those who know it, much clearer and less slang. And I feel like I'm understanding what's going on. Whereas in Paris, it's just wandering around closely. So that's been fun.
Try Montreal as well. Same thing.
Although I felt like in Montreal, people were very patient. And also what I appreciated was they gave you the chance to answer in French, and they would just work with you, even if their English was clearly better than your French, which I thought was
yes. Yeah. I still get a pretty quickly yes, would you like something on that bagel? And it's like, okay, fine. But I keep trying. I've only had 6 years of French education, and I still cannot understand it, but that's okay.
But see, that's why you got to go to the Congo. And also, you don't have the option to switch to English there, so it just kind of forces you to stick with it. So that's been good. And also, it's just really cool to see people really excited about something I care about. And it's their idea. It's their project. I'm helping them, but it's not like I'm trying to convert people or lecture them. They know what they're doing, and they just want help. So this conference that they organized in Kinshasa in September that I brought my son to was the first palliative care conference ever in the DRC. And there were hundreds and hundreds of people. It was really cool. And for a country that's still struggling with a war, on the border of Rwanda, for them to be doing something like this is really exciting, because if they get it off the ground, it could be a focal point for all French-speaking countries in Africa, a place for lots of people to get trained in palliative care. Yeah, because that doesn't exist right now. There's quite a lot in Uganda, but there's nothing Francophone in palliative care in the whole of Africa. So in terms of official training programs. So I think they could get people from lots of other countries coming through. There's a lot of potential. But I guess back to the beginning of your question, starting my career with Doctors Without Borders forever changed and affected the way I practice medicine. I just can't imagine what I'd be like if I hadn't done it now. But I think a lot more conservative. I mean, those first 6 months where I was working in Liberia straight out of residency completely by myself. in this hospital with one ER doc from the Australian outback who was basically like Rain Man, and amazing and could like diagnose an acute abdomen with like a tiny little ultrasound. Him and then whoever happened to be rotating through the OR, like we were the hospital. So I didn't consult because there was no one to consult. And I didn't run any tests because we could only get like one potassium a week. So it's like, just eat a lot of bananas, man. I just like, I can't monitor things like the way I did in the US, but in a way that was very freeing. And it made me really focus on the basics. Like, what does this person look like they have? Like not what does this CT say or what about this Chem 7, but like, what do I really think is happening? Yeah. And obviously I wasn't always right, but being able to live with that uncertainty in a way that I don't see people practicing in the West doing. I feel like everything's got to be answered and we got to be sure. And then we've got to run these other tests. And what about this ESR? And I mean, we didn't have an ESR,
Right. Yeah, you're like, that's probably elevated right now. they're probably septic. Like
you have a communicating chest wound from your TB, which you can see like inside your chest. So yes, you probably have inflammation. But it was good for confidence for sure. And then also for perspective, because I was working with MSF in a hospital where we really had no ventilators. So if somebody went into respiratory distress, that was it. That's it. Yeah. We're just going to help you die. I mean, the ER doc could intubate people, but it's like a bridge to what? Like we had one.
Yeah, you can't.
Ventilator for the OR, like it's not,
I mean, I'm just, when I was 20 years old, I saw my first patient die, and it was a 2-year-old girl. And she died of what, in retrospect, was probably meningitis. Could have been tetanus, I'm not sure. But it was horrifying, and it was very humbling. And it changed the way that I wanted to practice medicine. It changed the way, like, what I would want to go into. I was like, swore off peds. I was like, I can't. It's not my thing. I don't want to do that right now. But yeah, when people would come in with snake bites, that, there's not much you can do. There were no ventilators. There was nothing like that. I mean, not that I, 20 years old, knew what to do with one, but I mean, none of the other doctors there could do anything. But there was definitely, I did learn, like fevers, body aches, mustard yellow diarrhea, and abdominal pain. It must be malaria. So great, got that one. But it did require a lot of talking with the patients, spending time actually figuring out what they had. And again, at 20 years old, I wasn't doing so much of that, but it was a great time for me to watch other doctors to do huge INDs and, different surgeries and things like that. It was really quite amazing.
Yeah. I mean, you see incredible doctors in those conditions because they're really using so little, just like their instincts and their memory and what they've managed to learn from textbooks. And yet they can be like that ER doc. I used to really read his notes. I'm like, wow, this is the first time I've ever read notes from the ER, but he was so accurate in his diagnosing, like, what does he think is happening? But in terms of changing my perspective, I would then go back to New Orleans and be working at Tulane and see all these people that we were keeping alive in the ICU. Like the study that showed like 80% of ICU doctors wouldn't want to be doing all the stuff that they're doing to everybody else. Like that's very real for all of us and you and in acute care in the US. And I felt like sometimes I was coming on service and like saving people from medicine, like it was harder to have conversations to extricate people from all these machines and all this stuff. From what we're doing. And it felt like everything was flipped and reversed. Like over there, we didn't have enough resources. So I'm trying to do the best I can to help people die from preventable illnesses. And then here we have way too many resources and I'm helping allow people to die in spite of all of them. So I think that's absolutely why I ended up doing palliative care.
Yeah.
In a word.
Yeah.
or two.
Absolutely. So I know that you're going to have to go here soon, and so I do apologize. But how do people get started with this? What kind of qualifications do people need if they want to go overseas? I think that getting started, people are probably going to do kind of 1 week, 2 week type things.
Mhm.
There are lots of those opportunities around them. Maybe we can talk about how you would get involved with like humanitarian aid, MSF, things along those lines. So how do people get started, and what kind of qualifications would they need?
You need to have finished residency, and it's really helpful to have a language. For humanitarian aid, French is surprisingly useful, but it actually wasn't my main language. I mentioned I grew up in Puerto Rico, and so Spanish was my main other language, and French was really rusty. So I wanted to mention, even if you've got a language that's pretty rusty, it's there. You just got to dig it up. So, in
Right.
terms of prepping, if you have any sort of foundation in any other language than English, I would start taking classes now. And what I did with French was I found tutors who could meet me in the coffee shop. We just start talking back and forth. And I've got a resident who's going into oncology who wants to help with this DRC project, and another psychologist who wants to help me out. They both have distant French. And so they're just taking classes now so that they could be in a position to go there and actually talk to patients. So that's something you can do before you've left the US. And it's kind of a cool way to prep. And MSF, for example, Doctors Without Borders, if you have French, it's going to be way easier to get a job with them and way easier to get placed because they're French dominant in terms of what countries they go to. So Duolingo, that's what my husband does, or just find a conversational tutor. That's really helpful.
Yeah.
And then I think the short-term gigs are a good idea because it gives you a feel for what it's like to be abroad. You don't want the first time you ever left the country to be when you're in a war zone. Like you need
Yeah.
to take in some short trips. And if you're brushing up on a language, like strategically pick countries where you can practice it because your language is going to advance so quickly in a few days of just trying to figure things out
Yeah.
when there's no one to speak English with you. And you don't have to go to like really intense place. You could go to the Caribbean and practice French or Spanish or whatever. It helps a lot to have an organization that you go to for your first big mission or trip or project. So I do recommend something like Doctors Without Borders or Partners in Health, like one of the major ones. They're going to get you in the country. They're going to be responsible for your safety. They're going to help you get your medical license. If you want to just John Wayne it and show up, it would be better to do that when you know the context a bit. And you have friends you can stay with if stuff doesn't go as planned, but just showing up in wherever and being like, here's my diploma. It's kind of an inefficient way to do it at best. I don't
That's
find
putting
that
it lightly.
I don't find that people are really doing that now. I feel like
Yeah.
people are good about better than I was about getting more training. You can do a fellowship in global health. So at UCSF, we have a global health hospitalist fellowship you can do, which is kind of a nice way to get your foot in the door and also get some academic exposure. And you can work in some of the sites I mentioned, including Navajo Nation, so you don't even have to leave the US. You can get that sort of training in a few places now. I'm sure I would have done it back when I finished. They just didn't exist then.
Right.
But if you're not doing a fellowship, then I think you should look for a bigger organization.
Okay. So just really quickly, what about, are these, well, we don't worry about pay. Like it's kind of like the shorter ones, they probably won't pay. MSF, I think they're like a couple of $1,000 a month. Is that right?
Yeah.
Something like that. So it's probably not for you to pay off your student loans doing that. But what about advice would you give for people that are kind of early in their career and then for people
Yeah.
late in their career?
So,
Kind of
yeah.
later and kind of like, I want to just kind of, kids are out of the house and now I'm ready to go and I want to go do something.
Yeah, those are two good times to do it because, in fact, with MSF for the American doctors, it was either people in their 20s or like people in their 60s. So I think the people in the middle had a harder time because they'd have a clinic they had to leave behind or, kids in middle school and they just can't disappear for 6 months. But older and younger works pretty well. On the younger side, you can I was able to defer my student loans while I was doing MSF. So I didn't accumulate a bunch of, they didn't penalize me for not being able to repay for 6 months. I did that a couple of times. And you've got a very low burn rate. So in Liberia, post-war, there was really nothing to spend money on. There was not even any ATMs. So I barely spent any money, and I lived on half of a US doctor's salary. And then all the money I made with MSF, which at that point was like between $1,000 and $1,500 a month, I just used to keep my apartment back in New Orleans, and I broke even. Obviously now I'm in a different scenario where it turns out kids are expensive. But we do, Zach's going to finish in the next year or so. So that's my husband. He'll finish anesthesia, which is a pretty portable, turns out, choice for working abroad. And we're looking at either just to get out of the US pretty soon, which is what we're currently interested in for obvious reasons. We're looking at locum tenens options because they'll do sort of like what Doctors Without Borders did for me, like get you out of there, get you all set up, and get you a nice hospice gig in Saipan. So we may do that initially just to get out of here with all the kids and then sort of look at residency somewhere else. But on the Congo project, there isn't any locum tenens because there's no one to pay you. And the people I'm collaborating with, half the doctors aren't even really salaried. So it's like I can go in there and negotiate. So whatever work I'm doing in the DRC is going to continue to be pro bono. And we're looking at trying to spend a year there when they launch the fellowship. But Zach and I are probably going to try to consolidate shifts, probably in the US, and then just go there and again have a low burn rate, just like I did before. Because, for example, we can put all 3 of our kids in French private school in Kinshasa for something like a third of one kid's tuition in San Francisco. So these things that we're just flushing money down the toilet. We wouldn't have that expense.
The money in the furnace. You just shovel it in.
And we rented out our house in New Orleans already, so we'd be paying low rent there. So I think the key to make it work financially is figure out something to do with your loans so that, you're not in like loan purgatory. So you're able to defer them or at least keep making the payments. And then if you're on the later side of stuff, make peace with just doing some pro bono work. Like, I look at it as sort of a charitable donation. I have relatives who give a tremendous amount to charities every year. That's kind of stunning, amazing. And I just think, well, I guess I'm donating a lot of my time. That's what I can do right now.
It's a gift.
And then if you're just ready, just get out and not necessarily work in the resource limited setting, but get out of the US, for example, locum tenens can get you there quickly.
Yeah, absolutely. I am planning on doing kind of an episode with expats about how people have done it and like how Andrea and I did it. But I definitely have some friends who have done it very differently and just kind of worked a week or a week and a half and lived in Paris. And so you can be very, very flexible. Like you said, just kind of stack everything and then you make a lot of money. It's very intense. And then you go and work somewhere else and you don't make a lot of money, but you don't burn a lot.
I want to watch that episode. So please let me know.
Yes, I will. All right. I really do appreciate it. I know that this has taken up a lot of your time, so I cannot thank you enough. But now everybody knows what I already knew, which is how cool you are and how fun and interesting you are. So come have a margarita with Marcia Glass, and we will all have fun. So you're going to see Trombone Shorty tonight, is that right?
Rebirth.
Yeah. Sorry. Yep. Okay. No. Rebirth.
Trombone Shorty's coming in a few months. You're right. But Rebirth is here tonight. And next time, Rob, we should wear matching T-shirts.
Yes. They'll be here sometime. All right. Well, thank you so much. I really, really appreciate it. It's great talking to you. I really appreciate it. I'll talk to you soon.
It was fun. Thank you too.
Thank you for listening to another episode of the Interesting MD podcast. Please check out my content on YouTube at Interesting MD and follow me on TikTok, Blue Sky, Instagram, Threads, and Facebook at The Interesting MD and on X at Interesting MD. If you have comments or questions and want to get in touch with me or any of my guests, please DM me on socials or email me at rob@interestingmd.com. If you have any ideas for a show and you want to share your hobbies with me or don't know where to get started on your own project, you can email ideas@interestingmd.com. Please like and subscribe to the podcast and YouTube channel to get the latest content. Much appreciation to Falter Media for editing, producing, and posting all Interesting MD content. Check them out because if they can do this for me, imagine what they can do for you. See you next week.